today we had a wonderful rounds discussion led by none other than Robert Snow with Synergy Physical Therapy. And today he's accompanied by his wife, who was also the patient of the day, which is always super interactive and engaging. If you could, Robert, why don't you just break down kind of the title was The Uncommon Psychomotor Injury. Why don't we jump into kind of what the conversation was about today?
Sharla had a decompression illness injury when we returned from a dive trip 6-7 months ago. It's really an uncommon type of an injury in her case because it didn't happen immediately. It was delayed. The symptoms never really presented. And so that was sort of the confounding factor. And as we dug into the research, and even you guys at Summit had helped me out as we were just trying to get brain scans and everything else, found out that Sharla has a PFO, patent foraminovalle in her heart, which allowed the nitrogen to bypass the whole circuit and go straight to the brain, caused some short-term cognitive and some motor issues.
And Sharla, why don't you tell us briefly what your symptoms that you were experiencing kind of at the beginning and then throughout the course?
So they were a little bit delayed, which is unusual. And normally with decompression sickness, when you're learning to dive, you hear about the common symptoms being joint pain, being number one, rashes. And so I wasn't thinking that this was decompression sickness, but the initial, because we were on a dive boat all week, those initial symptoms were dizziness. Well, I just got off of a boat. I've had seasickness. That didn't really signal to me anything other than I've been on a boat. Dizziness then led to some weakness in my legs. Over the course of probably 3 or 4 days, it continued to worsen. I was having cognitive difficulties, paying attention, being able to focus on a conversation. I was having some memory loss, struggling to find words. I felt a little bit intoxicated. Over the course of the next few days, I started to have some visual disturbances. I had double vision, blurry vision, depth perception issues. Did I miss anything? Difficulty being around conversations, just a lot of light sensitivity, sound sensitivity. Did I miss anything?
No, I think it's it, yeah.
I mean, when Robert came to me, I think the thought was stroke-like symptoms, post-concussive symptoms. So, I mean, we kind of went around the world, and I'm sure you worried about your wife, had kind of really done a deep dive into the literature, trying to figure out what was going on. I found it interesting, and I didn't know this, maybe it's well known, but there are 2 types of decompression illness. There's type 1 and then type 2.
Yeah.
Kind of, how did you come to that information?
Just as we're digging into it, because she never really fell into the type 1 category, and type 2 is more severe. So there's always type 1, which is the joint pain, which is almost always immediately after returning from a dive, and some dizziness. And so they call it the bends because people just bend over in pain. It's like this immediate thing. There's a whole diver's network for treating that symptom as rapidly as you can, and yet we didn't have any of those. And if left untreated, those symptoms then progress to type 2, which is a dizziness, confusion, loss of consciousness at times, difficulty finding words, like all those types of things. So when we got the diagnosis or the symptoms matched 2, and we're like, well, we never had 1. How do you progress from 2? And by the way, these are supposed to happen immediately, yet these symptoms came on after, say, a week, and it continued to get worse. And that's when cardiology finally found the PFO, which explained the fact that now the nitrogen, instead of going through the rest of the body, is actually shunting straight to the brain and causing those type 2 symptoms.
So kind of walk me through then kind of what the treatment course looked like after that.
Yeah, Robert actually contacted the hyperbaric medicine here at Utah Valley Hospital. They were incredible. He got me an appointment right away. Started out with a MOCA test. So they brought me in, did an evaluation. The MOCA test is the same test they give for carbon monoxide poisoning. And it assesses recall, memory, executive function, different things. So they tested it, and it was really challenging. It was really challenging to just follow a simple little pattern or to draw a cube, which I did not do successfully. And then they put you into the hyperbaric chamber. So they have you take all of your clothing off, put on scrubs. You can't wear any jewelry or have anything electrical, obviously, going on because they're trying to minimize any risk of you're in oxygen, so fire, right? And then the first treatment, they took me down 3 atmospheric pressures. So that's about the equivalent of being 65 plus feet underwater. And so you have to clear your ears just like you would if you were diving. It feels a lot like you're diving, except you're not in water. And you're getting 100% oxygen. And then they have a movie that you can watch. You just lay there in this glass tank and you're watching movies. I watched a lot of rom-coms that week.
And there's a lot of different patients there undergoing different types of treatment, wound care, and other things like that. So it's pretty fascinating. And then you made the comment about how there are few hyperbaric chambers in the United States, and we in Utah are fortunate to have
so lucky.
Some of the best hyperbaric chambers and providers.
And providers too, yeah, exactly.
So I think that, the takeaway there is that, obviously don't give up. I mean, you could have very well just said, hey, this is what it is. But, obviously your symptoms were getting worse. You made the right decision to seek out help. Obviously, from a neurosurgery standpoint, we were limited with information, but you were able to finally find the right person that identified the underlying problem. And then it was very fortunate that you were able to receive treatment right away. Just kind of speaks volumes to the network and community kind of access that we have here. So
I'm grateful for the medical community that we're a part of. There's so many great providers, and just the ability to reach out and have conversations, just much the same way I asked you. I'm like, hey, can you take a look at this and just tell me what you think are the next steps? Do you know somebody that I can go to? And all those referrals and all those conversations are great.
Well, that's wonderful. Yeah. Well, thank you so much for taking the time to come talk with us today and share this incredible story. So,
absolutely.
Thanks.